Hi, everyone. We're going to get started now. I'm Patricia Manti. I am a communication and knowledge management advisor with USAID's Water Office. And I'll be doing the intro and passing on to our presenters in a minute. Thank you so much for joining us today for what we anticipate is the first in a series of webinars to highlight findings from some independent post-project evaluations that the Water Office is supporting to better understand factors that influence the sustainability of its WASH activities. Today's webinar will present findings from two complementary 2016 evaluations of the sustainability of sanitation and hygiene outcomes associated with USAID's RANO-HP program in Madagascar, which was active from October 2009 to June 2013 and was implemented by a consortium led by Catholic Relief Services. Presenting today are Jordan Emilio of Villanova University's Sustainable WASH Research Initiative in Madagascar, and Annette Fay, who conducted the Water CKM Project's Madagascar ex post evaluation of RANO-HP. Both activities examine the introduction of public-private partnership models for managing water and sanitation infrastructure. Villanova's research focused on the long-term reliability of RANO-HP water systems, while the Water CKM evaluation studied the sustainability of RANO-HP sanitation and hygiene outcomes. Jordan Emilio is Director of the Engineering Service Program at Villanova University's College of Engineering, and he's currently working on his PhD on the sustainability of water infrastructure at Loughborough University. And Annette Fay is a Monitoring and Evaluation Specialist with the USAID Water CKM project and is the lead researcher on this series of ex-post evaluations. She has a master's degree from Sciences Po and Columbia University. And moderating today's webinar will be Abby Jones, who is a water and sanitation advisor in USAID's Water Office. Just want to have you note the location of the question and answer box at the bottom right of your screen, and you'll use that to submit questions at any time during the presentation. But questions will not be answered until we've heard from both speakers. And if you have any issues, as Clarence has mentioned, you can try to send him a chat or put a question in the question box. And if sound disappears at any point, let us know. And I also need to let you know that today's webinar is being recorded, and we will be sharing the webinar later in the week. You will be able to find the slides from today's presentation under handouts in the menu, and that will also include the full evaluation of the RANO-HP activity, as well as a shorter evaluation brief and possibly some other resources. And all of these resources can also be found on USAID's new Knowledge Water Hub at globalwaters.org. Now I will turn things over to Abby.
Thanks, Patricia. Under USAID's water and development strategy, we committed to revisit the sustainability of our water and sanitation investments. And as part of this effort, USAID, together with Rotary International, launched and applied the Sustainability Index Tool, or SIT, between 2013 and 2016 to 8 completed USAID-funded activities. Building off of this work, USAID has launched a series of ex-post evaluations, the first of which looked at USAID's rural access to new opportunities for health and prosperity, or RANO-HP, which is the subject of this webinar. RANO-HP was an $8 million activity that was implemented between 2009 and 2013 in 26 communes along the eastern coast of Madagascar. Catholic Relief Services led the implementing consortium, which included Caritas Care working through local NGO platform Wahari Sulama and 2 private sector companies, Sanandrano and Bushproof. RANO-HP was a rural water and sanitation activity that aimed to increase sustainable access to improved water supply, enhance coverage rates in sanitation, and improve hygiene practices among households. RANO-HP did this by constructing or rehabilitating around 1,000 water systems, including both public or shared systems, private or shared systems, using a public-private partnership approach, which is going to be discussed more during the presentations. They used a community-led total sanitation approach that resulted in 240 villages becoming open defecation-free certified. They trained 400 local community health workers in key hygiene behavior change messages around hand washing at critical times, properly handling, storing, and treating drinking water, and using an improved latrine. They also established village savings and loan associations and worked with 2 microfinance institutions to create and introduce a loan product specific for latrine construction. And finally, they established commune-level commune-level wash stakeholder groups that produced commune-level water and sanitation business plans. So with that quick synopsis of the activity, I'll turn it over to Jordan Ermilio to share results from Villanova's study on the sustainability of water systems built under RANO-HP.
And I'm going to be presenting the results from a 2-year study on the sustainability of water infrastructure in Madagascar with a focus on piped water distribution systems. The majority of the systems investigated during this study were implemented during the RANO-HP project and included the use of a PPP model, also referenced as the public-private partnership approach to managing water service delivery. And this is a pretty unique and innovative approach wherein the majority of the international development water sector is really looking at community management or even local government managed systems. And wherein those systems are more common, the PPP model is a little bit innovative and particularly with respect to initiatives in Madagascar. So prior to discussing some of the research framework and some of the results, I would like to take the opportunity to thank our program partners in Madagascar, Catholic Relief Services, for all of their support for this study. In particularly, the CRS WASH team in Madagascar has been incredible to work with, and we sincerely thank them for their friendship as well as for their support. So the research framework for this study entails a unique approach to monitoring and evaluation, wherein a lot of M&E initiatives are focusing on understanding the external factors that influence sustainability. Our study really proposes that the reliability of that service and furthermore the strength of management are essentially prerequisites to sustainability. So wherein we recognize these external factors that influence sustainability, we're also trying to focus on aspects of sustainability that can be objectively measured and continuously monitored. So in terms of the objective metrics that we used, we basically pulled together the reliability of water infrastructure in 2 categories, one looking at water quantity and the other looking at water quality. In terms of water quantity, we were looking at per capita availability and the system delivery efficiency of the water distribution system. In terms of water quality, we were looking at compliance with World Health Organization standards on microbial, chemical, and physical parameters. And with respect to strength of management, we were looking at financial and operation and maintenance characteristics of the system. This study also used household-level customer satisfaction surveys, where we asked households about their satisfaction with respect to water quantity, water quality, and the management of the systems as a way to triangulate and validate the results. Furthermore, investigating and really framing the discussion in the water sector around customer satisfaction and trying to better understand customers at the household level is an additional goal of this particular study, wherein we feel that it's important to start to talk about water users as customers rather than beneficiaries. So the rationale for this investigation can really be highlighted in this diagram here, whereas a lot of the M&E efforts really understanding how these external factors, for example, investigating social, technical, environmental, economic, and political factors, trying to understand how those external factors actually influence the sustainability of the water and sanitation initiative. Our study is really trying to understand how management mitigates those external threats to sustainability, with the hypothesis that really, really strong management can actually reverse that trend and begin to influence these external factors from the inside out. At the same time, our study really recognizes the need for whole systems thinking and understanding how a lot of these external factors actually influence each other as well as the performance of the WASH initiative. So the data collected during this study included the monitoring of 11 systems that were constructed during the RANO-HP, the Rationale, and RANO programs, all of which were implemented as CRS as one of the lead partners and using USAID funding. The data collected entailed installing pressure transducers in water storage tanks to monitor the water availability in the system, water quality sampling and analysis for microbial, chemical, and physical parameters, key stakeholder interviews using the Sustainable Index tool, sanitary inspections, and household-level customer satisfaction surveys. The 6 locations that we'll present about today are shown here, where it's important to recognize that the results from this study are delineated in terms of per capita water using the number of customers directly connected into the system, which might differ in terms as compared to the total number of beneficiaries from the system, which might include secondary or indirect use of water. So this figure here is an example of a 2 days of water levels monitoring in the Mananara system. Mananara is a unique system studied during this research because with respect to the total number of customers as well as the rate of new connections, it is significantly higher than any of the other systems studied during this research. So the total number of systems, or the total number of customers connected on this system is a little over 7,500 customers. And since the time of RANO-HP, the rate of new connections has been roughly 30% annual growth, which is a significant growth rate for any system, which basically means that this system is going to double in population if that trend continues within 3 years. So looking at the water levels in this system, trying to understand how or the limits of this system, the capacity for new customers and so on, is really an important aspect of managing this particular water system, as well as any system that's going to have or experience growth. So the 3 things that we're looking at here is the net flow into the system, which is represented by this particular increasing water level in the storage tank. This right here is November 19th at midnight. And you can see that the water levels are increasing during that period prior to the peak morning demand, where the water levels start to decline. So what we're monitoring here is the slope of this line to better understand inflow into the system, and the slope of this line in order to better understand peak demand on the system. The third thing that we're investigating is the incidences of tank empty conditions. So wherever the proportion of time that the tank is empty is giving us a really good understanding of the capacity of the system, as well as the reliability of the service. So one of the interesting things with this particular example here is how the reliability of the service changes from one day to the next. You can see here that the slope of this line prior to midnight on the second day is significantly different than it is here on the first day. So because of that, this system was empty for the majority of the second day during this particular example. So really understanding how these systems function and having a better resolution with respect to performance of the water systems is really essential, not only for managing the system, but for better understanding sustainability as a whole. So this particular slide presents some of the results. What we were looking at here is the customer satisfaction. This is a composite score of customer satisfaction, which takes into account the customer satisfaction on water quantity, water quality, and the management of the system. This is the system reliability scores for the selected sites. And it's interesting to show here that the range is pretty significant in that all of these systems essentially perform significantly different. So ranging from about 79% to the Tulungonia site, which was operating at about 100%. Additionally, we are looking at the average daily availability of water in terms of liters per person per day. And the range here is roughly 29 liters per person per day to approximately 65 liters per person per day. So you can see that there is a significant range. The sustainable access score shown here is a multiplier of the system reliability and the average availability. So what we're saying here is, for example, if you want to look at the Mananara site right here, what this example is showing us is that the average daily availability in the system was roughly 38 liters per person per day, but that water was only available 88% of the time. So that gives us a sustainable access score of 32.6 liters per person per day. Now, when you start to include water quality into the analysis, you'll see that the water quality results are relatively low, in that a lot of the systems are not performing to where you would want to see these results, perhaps 90 to 100% being a reasonable target here. But ultimately, if that 32 liters per person per day, 56% of that water was safe, then you would be able to quantify this as saying that the Mananara system during the course of the study provided 18.5 liters per person per day of sustainable access to safe drinking water. So this is the approach that we're taking with this research in a hopes to really delineate and better define what it means to have sustainable access to safe drinking water. A particularly interesting result here is with respect to the Tulungonia site, where you can see it's also shown again here below. There was 6 months of data that was collected for this system, and the data shown on the lower portion of this slide is basically the proportion of performance when the system was not being managed by the PPP. So prior to installation of the PPP, the system was functioning for 3 months, essentially unmanaged, and you can see that the reliability score was significantly lower, and the sustainable access to safe drinking water was also significantly lower, shown here and here in terms of sustainable access. So one of the key findings here is with respect to the financial sustainability of the systems. What we did was we started to look at the initial feasibility studies that had predicted values of consumption in the system, and we compared that against the actual measured consumption values with respect to our study. And this really highlights one of the challenges with respect to the sustainability of the PPPs themselves, wherein the predicted values are significantly higher, more than 2 to 3 times higher than the actual values being and than the actual water being consumed. And this really gets to the financial bottom line of the PPPs, wherein the PPPs really need to be financially sustainable in order to have that incentive to continue to manage these systems in a reliable way. So with that, I would like to turn it over to Annette, and we will address questions afterwards, but please, again, type any questions in the Q&A portion here of the chat, where there's a little icon on the screen that says Q&A. So any questions with respect to this, please put them there, and we can address them at the end of the session. Thank you.
Thank you, Jordan. I'm Annette Fay, and I will quickly take the opportunity to thank everyone for making the time to listen in to us today. This evaluation was designed and conducted with my social impact colleague, Leslie Hodel, who I'd like to thank for all of her great work. I'd also like to thank our colleagues at USAID Madagascar, our colleagues here in DC, and everyone who assisted us in Madagascar by speaking about the RANO-HP activity. Our ex post evaluation of RANO-HP was the first evaluation in a 5-year series, and we have recently finished a second of the Indonesia Environmental Service Program. This report will be shared soon on globalwaters.org, which is our new knowledge hub that Patricia mentioned at the beginning of the webinar. And we are currently preparing the third evaluation in Ethiopia of the Millennium Water Alliance Program. For the evaluation series, we have 3 overarching questions on functionality, sustaining behavior change, and understanding the factors contributing to or impeding sustainability. For our study of RANO-HP, we focused on the sanitation and hygiene components of the project, which is distinct from Jordan's study. Our questions are broken into two general buckets. To what extent are the levels of sanitation facility functionality and hygiene usage or behaviors that were measured at the close of the RANO-HP activity still observed 3 years later? So we looked at to what extent the villages triggered with the CLTS have attained or sustained high latrine coverage in ODF status. And you'll see on this slide latrine constructed through CLTS and made from locally made material. The second sub-question of this first one is, to what extent have public sanitation and hygiene facilities constructed through RANO-HP maintained functionality and use? And you'll see in the middle of the photos at the bottom of this slide a monoblock, which is a structure that has a laundry facility, which you see at the beginning of the photo. On the side is a water point, there's a latrine, and there's also a shower. And our third sub-question, to what extent are hygiene behaviors promoted by the activity, such as hand washing, use of improved latrines, and treatment and storage of water still being practiced? And you'll see some children on the bottom right of this slide who are practicing hand washing. So the second major question that we looked at was, which factors influence the ability to sustain sanitation and hygiene facilities and behaviors, and why? And our first sub-question, in what ways and to what extent have village savings and loan associations and microfinance institutions been leveraged to finance household wash improvements beyond the end of the activity? And on this slide, you'll see in the bottom left a group of people sitting, and they are taking stock of the communal funds that have been gathered through the VSLA. The second sub-question, to what extent did efforts to build local capacity for latrine construction lead to sustained construction and maintenance of improved latrines? And on this slide, you'll see in the middle is an example of a locally trained mason through the RANO-HP project who is showing us a sandplat slab that he learned to build. The third sub-question, to what extent have efforts to improve governance and wash activities through commune water and sanitation business plans influence the sustainability of commune sanitation and hygiene activities? And on the bottom right of this slide, you'll see an example of one of these business plans. And for the French speakers, you'll notice that it's also in French. The longer name is investment because the plans helped people to think not only about the needs for infrastructure, but also a path forward in terms of investment. Our fourth sub-question, to what extent have efforts to form public-private partnerships to manage sanitation activities influence their sustainability? So similar to what Jordan was talking about earlier, but more honed in on the sanitation components of those monoblocks. And finally, what other factors improved or impaired sustainability? So what did we do? We used a mixed methods design combining a household survey with qualitative interviews. We replicated the RANO-HP N-line household survey, which took place at the end of the activity, along with a sampling methodology in all 26 communes. We were able to fully re-verify 15 previously declared to be open defecation-free villages using the same methodology that was used during the RANO-HP activity. We had a lot of luck with the former implementing partners in helping us identify not only the methodology, but a trainer who was available. We also conducted 53 key informant interviews and focus group discussions in 5 regions. And our field work took place between September and October of 2016. So to dive into the findings, related to latrine use, we found a significant decline in general household latrine use and use of a private latrine between 2013 and 2016, and significant slippage in use of latrines with washable slabs. Related to hand washing, possession of a hand washing station, as well as reported hand washing at key times, so before eating, after using the latrine, before preparing food, all decreased to baseline levels, and these results were statistically significant. We found a sharp, significant decline in proper disposal of child feces, meaning in a latrine or buried, and we weren't able to fully replicate the baseline values, but through a comparison to baseline report data, we believe that no 2016 levels for key outcomes slipped below the baseline levels, except for safe disposal of child feces. Coming to open defecation was still being practiced in most communities previously found to be open defecation free. Only 1 out of 5 villages was verified as maintaining ODF status in a complete review, and 1 of 15 showed evidence of likely ODF status in a partial review that didn't involve house-by-house verification of latrine usage. Coming to other findings from our study, related to vulnerable households, households with a non-literate respondent were less able to sustain most of their wash outcomes compared to those with literate respondents. Related to gender, slightly more female-headed households used a latrine compared to male-headed households, representing a reverse of the trend that was observed in 2013. Female-headed households maintained their use of higher quality latrines with superstructures or washable slabs over time, whereas this declined for male-headed households. And slippage in having a hand washing station was more modest among female-headed households compared to male-headed. Related to finance, the VSLA members are still using these groups as a source for wash funds. In fact, 27% of households reported that a desire to construct or improve their sanitation in the past 2 years, but were unable to, most often due to lack of money. However, the VSLAs were still used to finance wash improvements, and a microfinance product that was created during the RANO-HP activity is no longer being used in the rural RANO-HP zones, but it is being used in nearby urban centers. And related to the commune water and sanitation business plans, only in 1 of the 6 communes where we interviewed are the stakeholders still using these plans. So diving into barriers and facilitators of sustainability for RANO-HP, For the facilitators, we learned of several factors that seem to have contributed to the sustainability of latrine maintenance and use. So the simple technology of pit latrines and tippy taps for hand washing stations made it relatively feasible for many community members to build and maintain without continued intervention, depending on the financial situation of the households and the availability of local materials. We found that training local masons appears to have provided additional capacity for maintenance and reconstruction that was used beyond the life of the activity. As our interviews did indicate that 45% of households improved their latrine in the past 2 years using skilled labor. So both the skilled labor and using guidance from the local masons. We also observed that pre-existing social norms around sanitation behavior appear to have influenced sustainable latrine use in former RANO-HP communities. A good example of this is the lowest level of slippage in latrine use was found in the Atsinanana region, which had substantially higher baseline levels of latrine coverage, which perhaps reflects an acceptability and normalcy of latrine use that laid the groundwork for greater sustainability in the long term. And we also observed that repeated recent follow-up support was most likely correlated with higher access levels and lower slippage at the time of the evaluation. So overall, communes excluded, we did exclude some communes from our primary analysis after learning of contamination by some more recent CLTS activities. These are being implemented by the Ministry of Water and the Global Sanitation Fund. We did observe that these areas had significant improvement over 2013 levels of latrine use and hand washing station adoption compared to communes with no additional intervention since RANO-HP ended in 2013. And through the qualitative interviews that we did, one of the very common things that was cited as a reason for people to stop practicing behaviors that they learned was that there wasn't the threat or the constant reminder to continue practicing these new behaviors. Coming to the barriers that we learned related to sustainability, financial constraints were cited, and 27% of the households reported a desire to construct or improve sanitation, but felt that they were unable to due to lack of money or other priorities within their household spending. Environmental factors have also presented a barrier to sustainability in terms of the amount of space that is available to build latrines in tight villages, in areas where there are storms that are constantly damaging latrines, and in areas where water scarcity inhibits even the ability to find water for hand washing. Coming to poor management, our study had a much smaller sample size than Jordan's in terms of the public-private partnership model. And in the examples that we studied in Ilocos Est and in Aniverano Est, poor management was an issue with the monoblocks in the case of Ilocos Est, which we understood to be due to not enough time for the service provider and the commune and the community and the Ministry of Water to all establish a working relationship and properly manage the monoblocks according to their role in the public-private partnership model. Insufficient participation on the part of the Ministry of Water may have also contributed to that problem. And one last barrier that we noticed to sustainability, in particularly related to the commune water and sanitation business plans, is the limited government and external funding. While the goal of RANO-HP for the commune water and sanitation business plans was never to fully find funding through the government. The fact that there was so little funding, both from the government and externally, provided an extra challenge to those stakeholder groups who were trying to figure out how to move forward with their investment and infrastructure plans. So coming to our combined recommendations, train local workers in latrine construction and maintenance. We observed that the local masons that were trained through RANO-HP is a good model that we would recommend continuing with. Create village savings and loan associations and microfinance incentives for new customer connections. That will certainly continue to work and needs to be tweaked. Incorporate gender decision-making dynamics into planning, as we observed the difference in female-headed versus male-headed households. Adapt programming to the needs of more vulnerable households. And life cycle support for capacity building of public-private partnership operators, so during the initial planning, implementation, and management of water infrastructure. Jordan, I think you might want to jump in on how that relates to your study.
Yeah, absolutely. So sort of to continue this here in terms of key findings and combined recommendations, I think something with respect to clearer targets on water quality performance, particularly with a focus on locally driven water quality monitoring plans is really essential. And I think all of this with respect to continuous monitoring of water infrastructure, there's this notion that you can't manage what you can't measure, right? So even while we were in the field, very often we were doing our water testing and water sampling and analysis, and the PPP operators and so on were there really engaged and interested in the results, primarily because they had to make decisions that day and that week about whether to increase the chlorination or whether to clean the filters and so on. So without the ability to monitor themselves and to measure the performance with respect to water quality or water quantity, it's very difficult to manage these systems. So that kind of lends itself to my other recommendation and finding here with respect to developing monitoring and evaluation technologies that provide local operators with tools needed for better operation and maintenance. This is a really important piece to this, and my hope is that as a water engineer myself, we can really help move the sector forward with respect to low-cost technologies that the water operators really need to better manage their systems. Finally, one of the anecdotal outputs here, based on conversations and some qualitative data collection, is with respect to guidelines in terms of capital maintenance requirements. Some of that is available in the service contracts with the PPPs, but at the end of the day, sometimes that information doesn't get communicated down to the local management level, and there's some confusion about who's responsible for capital maintenance repairs, whether it's the local government, whether it's the PPP, and expansions of the systems and things of that nature. So I did see a lot of questions in the chat. I was trying to respond to some of them separately here, but I do want to invite anyone to use my contact information here if you want to continue some of this discussion. I'm really, really sincerely excited about this work and hope to be able to connect with as many WASH professionals as possible through this webinar. I will turn it back over to the moderator and Annette.
Excuse me. Thanks, Jordan, and thanks, Annette, for these concise presentations. I think there's a lot to unpack here, and I would encourage everyone, as Jordan just did, to take a look at the reports that kind of get into greater depth around everything. While you all were speaking, I took the liberty of taking down some of these questions that had been floated and tried to bundle them a little bit. There was an initial question on sort of the time lapse between activity close and then when you all went back to look at the sustainability, and there was a related question about whether or not there was any follow-up in the interim by the government or other agencies, particularly on sanitation and hygiene in the intervention areas. So if you could take those questions first, we'll then move on to another bucket.
Jordan, do you want to start? Because I think your study actually began earlier than ours did.
So I believe that it was particular to sanitation, that question about the time lapse. But at least
I think it was both.
To our study, because of other development interventions in some of the regions, there was ongoing external support throughout this initiative. And in fact, I think because of the way that our research is very applied and trying to provide the type of data that's needed to better operate and maintain the system, I think even some of the research that we were conducting was, in a sense, an element of external support. So, yes, I believe that the majority of the sites that we investigated had ongoing initiatives by CRS during our investigation, and that our WASH team's involvement post-implementation of the project would qualify as some type of external support. So that's, it was a 3-year time frame with, well, it was 3 to 5 years time frame with respect to the time that the projects were completed and when our teams were in the field doing our study.
And that's similar to for the water CKM study. It was in 2016 when the activity ended in 2013.
Annette, can you address this piece about government or other agency follow-up on sanitation and hygiene in the interim period?
Yeah, the government, along with UNICEF, has been implementing a CLTS activity across the eastern coast of Madagascar. It's not one-to-one with the areas where we did our study. There is some overlap, and that was the reason that we ended up having to reduce our sample size. But they have been, my understanding is they continued from at the end of RANO-HP. They began a program that started even months after when the activity ended.
Okay, thanks. There were also questions about water quality and water quantity. On the quality piece, Eddie in particular wanted to know if quality was measured at the point of use or point of collection, and then what was the major water quality issue. On quantity, I think Srini pointed out that the per capita availability of safe water was relatively high compared to WHO standards of 20 liters per capita per day, but relatively low compared to Indian standards of 135 liters per capita per day. Can you talk through that finding?
Sure. So maybe I'll start with the water quantity question. So I agree with that in that, well, I think that the 20 liters per person per day World Health Organization standard is in fact too low. Some of the studies and the majority of the stuff that I've worked on, we are targeting on the order or seeing on the order of 80 to 120 liters per person per day of actual consumption using some of the methods that I described here. So I agree that that 20 liters per person per day is low. Now in these particular cases, the systems that we were studying included both private connections and what were called social connections, where a number of homes, 5 to 10 families, would team up and have one single connection for their community, their neighborhood. So, the consumption levels might be impacted by some of that, whereas, private household connections, you're going to see higher consumption levels, and communal or social connections, you'll typically see lower consumption levels, because it's more difficult to access the water. You might have to travel a little bit of a distance. Now, in addition to that, the reason why some of these water consumption levels were a little bit on the lower side compared to what I've seen in other sites in the order of 100 liters per person per day is because of access to secondary availability of water. So people were still using some surface water sources for secondary household consumption, not direct consumption, as well as shallow wells and some hand pumps that were already in the area. So because of those secondary access points, which are essentially free, the water quality is not as high, or the convenience is not as much, but it's essentially a free water source, and that's the reason why they were a little bit lower than you might expect with respect to, say the India standard of 135 liters per person per day. Now, with respect to the water quality, I guess the question was around the sampling locations, and we were taking samples based on World Health Organization protocol that calls for 12 samples per system up to 10,000 customers. And in fact, we typically took 12 samples per round. And to have a total of roughly 24 samples, we would take duplicate samples per every 10 samples. We were taking duplicate samples, laboratory blank samples as well, as a part of a standard QA/QC protocol around water monitoring. And we took samples from the source, from the water storage tanks, and a distribution of homes that would represent the total system itself. So, I think the approach there was an important one in that we worked with the local water operators to create a sampling plan based on their knowledge of the distribution system. We worked with them to identify what would be a representative sample of the whole system, and then worked from there. I guess there was another question around the major water quality issue. So what we did was we aggregated the results in terms of microbial, in terms of chemical, and in terms of physical water quality parameters, and then evaluated those results on each of those. And by far, the microbial samples were we're not passing in any respect, right? So sort of as a general rule, a general sort of observation, about 20% of the microbial samples taken, and this is across 11 sites with 20, 30 samples per site, close to 20% of those samples passed. So 80% of the microbial samples tested for coliform, total coliform, and E. coli failed. Now, I think the important thing with this is to recognize that just because there's coliform in the sample doesn't mean that it's pathogenic contamination. It just means that the system is vulnerable to pathogenic contamination. So people can accumulate resistance to bacteria, and particularly in a local setting like this. And so we felt that it was very important to not have a pass-fail approach to monitoring water quality. In other words, if one of the analyses failed, the whole sample didn't fail. All right, so we might take 10, do 10 analyses, study 10 parameters per sample, 2 of which were microbial. If one of those 2 failed, the whole sample itself did not fail. We tried to add a little bit of resolution with respect to the data around water quality.
Thanks, Jordan. I think similarly there was a question about latrine quality. Some of the photos that Annette presented, I think, drew a bit of concern about the safety of those toilets, particularly in relationship to safety of women. And there was a question about whether or not the decline in latrine usage was somehow correlated with the quality of the infrastructure. So Annette, if you could speak to that, I think that would be good.
Yeah, happy to take that one. So related to the quality of the infrastructure used in the construction of latrines. So as is common with CLTS, people were using whatever is available in their regions to construct their latrines. I hope that the photos that were included in the presentation don't make it seem like they're, especially that one cactus latrine photo does not mean that all of the latrines across the project were that makeshift. The end goal was certainly for people to adopt the behavior change of constructing latrines over the long term and continue investing and get to the point where they would be able to purchase a washable slab and create a nicer latrine. I don't think that in the 4 years of implementation, RANO-HP was able to achieve that for all of the areas where they worked, but I think that was their ultimate goal.
Great, thanks. There's also a question here about the financial sustainability of the PPPs and whether or not you looked at whether operating costs are actually being covered. Ella writes that the predicted consumption figures tend to be much higher than the actual, and that it's also a function of people not having enough of an understanding of how these smaller pipe systems work.
So that's an excellent question. Certainly something that we continue to look into, and something that we're hoping to really get a better understanding of with respect to these systems as a part of this ongoing research effort. Just in terms of the expectations and the responsibilities of the PPP, that's really one of the findings and the things that we're highlighting and bringing out as something that could be addressed pretty easily with some external support in terms of what are those clear responsibilities of the PPP. I guess the other thing to really note here is that there aren't really any existing microfinance opportunities for households to make new connections. So what's sort of happening anecdotally is a lot of the PPPs are giving out a loan to the household to connect their system, and because the household typically has to pay for the service connection to their home, the water meter, the piping, and so on. And the PPP, the water operator, the water utility, sort of makes the connection and helps the household in terms of providing a high quality connection into their home. So one of the challenges there is that without sort of these small loans that would be available at the household level, every system is a little bit different. It's a little ad hoc, and some of the PPPs who are in a financial situation to be able to provide a small loan to the household, or to be able to front the cost of the household connection and integrate that into the bill somehow, are doing so, but that's not necessarily a regulated or a standard practice. It's a little bit ad hoc. So again, I just want to recognize that question, and that I didn't necessarily answer it entirely, primarily because it's something that we're recommending as sort of a follow-up type of work to get to the bottom of something.
I'd also like to add, in particular to that question, that one of the things was interesting about RANO-HP was that they had different types of contracts that were used in the PPP model. So, for example, there was one that was created very close to the beginning of the project, which allowed all of the stakeholders to have the time to react a little bit better and get a sense of if the costs weren't accurate, they could modify things. Whereas in some of the other examples of the contracts, when they were when the infrastructure was constructed later and when the contract was established later, that I think gave them a little less wiggle room and modification, like room for modification. So one of the things that we are trying to suggest is to tend more towards the earlier model, where you have that time to work out whether something's realistic or not for the consumers.
Thanks. Brooke wanted to go back, Annette, to that quite shocking finding of this sharp decline in safe disposal of child feces relative to end-line, and what you all think is sort of the driver behind that. There's, some concern that maybe it was an error in the calculations, but do you have any hypotheses around that?
I am not sure about that. I would have to look back into I'd have to look back into our data, but I don't think that it was something we had focused enough on in our qualitative interviews. And it really begs that it would have been great if we had done the household survey and then had 2 months to study all of the findings and then done the qualitative interviews, because then we could have dug into some of those issues more in more depth. I don't think that it is related to an error in the baseline. I think that is the finding.
Okay, and I think she was also hoping that you could just clarify about whether or not UNICEF was active in the areas where you sampled or not in the interim.
No, the ones that we are reporting as our results, there is no active other activity, and we've been very careful in terms of looking at contamination from the government UNICEF project that's happening, and also a global sanitation fund activity that's been going on for the past few years. We do include in the report findings from areas where there is contamination, but the findings that I reported on are only in clean areas.
Great, thanks. I want to be respectful of everyone's time. I know there are a few more lingering questions, but perhaps those can be taken offline. I really wanted to thank our presenters, and I also just wanted to reiterate that the USAID is very much excited about this whole evidence-based programming that we're trying to take forward, and we're really grounding all of that in both the SIT results as well as this ex post series that is fortunately quite coordinated with the Villanova study. So we had a holistic view of RANO-HP. And if you all on the phone or on the webinar have other resources you could point us to help develop this evidence base, we'd be greatly appreciative and look forward to continuing these conversations in the months ahead. So thanks very much to everyone. I don't know if Patricia wants to say a final word or Clarence, but I will sign off from here.
Thank you, everyone, for joining us today, and stay tuned for information when we are ready to present the findings from the Indonesia ex post evaluation. Thank you.